After spending 3 nights at the Walter Reed Medical Center, U.S. President Donald Trump staged a dramatic comeback to the White House. What shocked an already affected nation, however, was Donald Trump's removal of his mask on the White House stairs. With the virus still taking lives across the United States, health officials and doctors are working around the clock to save lives and prevent the spread of the virus. Now some say Donald Trump has simply returned to the hot zone where the cases are spreading by the day. So does Donald Trump's return to the White House signal that he's ready to restart his campaigning? And what is the condition of his health currently? Our next report tells us.
U.S. President Donald Trump returned to the White House after staying at Walter Reed Medical Center for nearly 4 days. His return was like a scene from a movie. Trump immediately took off his face mask as he saluted the Marine One from the balcony of the White House. After testing positive for COVID-19 and experiencing low oxygen levels multiple times, Trump seems to maintain his stance on the pandemic.
And one thing that's for certain, don't let it dominate you. Don't be afraid of it. You're going to beat it. We have the best medical equipment, we have the best medicines, all developed recently. And you're going to beat it. I didn't feel so good. And 2 days ago, I could have left 2 days ago. 2 days ago, I felt great, like better than I have in a long time. I said just recently, better than 20 years ago. Don't let it dominate. Don't let it take over your lives. Don't let that happen. We have the greatest country in the world. We're going back to work. We're going to be out front. As your leader, I had to do that. I knew there's danger to it, but I had to do it. I stood out front. I led.
Although Trump has returned to the White House and is willing to resume his re-election campaign, doctors say that he is not out of the woods yet. Doctors have not yet explicitly stated that Donald Trump is no longer contagious and fit enough to travel again. The medical team declined to share medical scan results of Trump's lungs and the date of his most recent negative test for the virus.
Over the past 24 hours, the president has continued to improve. He's met or exceeded all standard hospital discharge criteria. He'll receive another dose of remdesivir here today, and then we plan to get him home. It's been more than 72 hours since his last fever. Oxygen levels, including ambulatory saturations and his work of breathing, are all normal. Though he may not entirely be out of the woods yet, the team and I agree that all our evaluations, and most importantly, his clinical status, support the president's safe return home, where he'll be surrounded by world-class medical care 24/7.
Trump is still undergoing a 5-day course of remdesivir, an intravenous antiviral drug.
It's a little difficult to understand exactly how compromised his lungs are with COVID-19. We're told he had 2 episodes of transient drops in oxygenation, but not enough that he needs oxygen routinely, and we generally wouldn't give steroids for that. There was the sort of strange statement that his chest CT findings, which is a very detailed, fine picture of the lungs, has expected findings. I would expect the findings to be normal, but my sense is they meant expected with COVID-19 pneumonia.
After President and First Lady, a number of White House staff members, top Republicans, Secret Service agents, and journalists also tested positive for COVID-19. White House Press Secretary Kayleigh McEnany is the latest staff member to contract coronavirus. She also mentioned that before press briefing on Thursday, she had no knowledge of White House advisor Hope Hicks testing positive for the virus. McEnany's 2 deputies, Chad Gilmartin and Caroline Leavitt, are among at least 18 people connected to Trump's re-election campaign who have contracted COVID-19. The White House employs a number of non-political staff members who stay away from the public eye. This includes butlers, florists, housekeepers, valets, engineers, and cooks who work more closely with the first family than anyone else. To the White House, where his health will continue to be monitored. A medical unit of top-notch physicians, nurses, and personal assistants are working round the clock to help the president recover before he returns to his campaign duties. With easy access to testing facilities, world-class medical care, and potentially the most effective combination of medicines, US President Donald Trump was the most protected person from coronavirus. How will Trump's health and the secrecy around it impact his re-election campaign? We will be watching closely. US Election Desk, WION. World is One.